where I thought they were exactly where they needed to be, and then I found out I had cataract.
Patients who have cataract, the first thing they often notice is glare. Nighttime driving becomes more difficult. Sometimes colors don't seem as vivid as before.
I started gradually losing sight, and what really triggered my thoughts on this, to be honest about it, I was playing golf, and I couldn't see the ball, and it made you feel kind of foolish when you had people that are older than you could see the ball, and you couldn't see it.
So cataract scatters the light that's moving in the direction of the patient through their eye towards their retina. And because it scatters the light, it would be like having a camera where the lens of the camera is cloudy and the image then is scattered onto the film.
I called Pepose Vision Institute and said, I just want to get an opinion and a consultation. And the thoroughness of the exam that I met with Dr. Pepose. His staff did a great job and just really did a very thorough exam.
The initial consultation involves a dilated exam so that we can see the cataract through the enlarged pupil. And then once we make the diagnosis of cataract, we then discuss the treatment options in terms of which types of lenses are available. And then we go through a whole series of measurements.
And during that process, they talked about the limitations I might have if I continued to keep my cataract, or what I could do if I wanted to go ahead and have the surgery, and that I was at the point in my progression that I was able to have the surgery.
Cataract requires surgery, requires surgical removal of the lens, and then replacement of the lens with an artificial lens.
And I was a little concerned about it because I really didn't want anybody messing with my eyes.
Anytime that you think they're going to operate on your eyes, you're scared before you get started. But the surgery was very, very easy.
In the past, we had to make large incisions to do that. Now it's done through microscopic incisions that are so small they could self-seal without sutures. Also, the lens implants that we have now are made out of pliable material that can be scrolled and then injected in the eye, and then it unfolds, allowing, again, a microscopic incision that will self-seal.
I had Dr. Kazi do my procedure. He did really a wonderful job.
We consider cataract surgery at Pepose Vision Institute as a vision correction surgery, just like LASIK or any other surgery that we perform. The beauty of cataract surgery is that it's a one-time procedure. The cataract does not come back after we've removed it, and because we're using an artificial material which stays stable, the vision stays stable for the long haul.
So that was appealing to me, to not have to have glasses after surgery.
Crystal lens is the only accommodating lens approved by the Food and Drug Administration.
And Dr. Pepose did my surgery, which I felt very good about.
Surgery is done under just numbing drops, topical anesthesia, a lid holder to prevent blinking. The patient simply looks up at a light similar to LASIK. The surgery takes about 15 to 20 minutes. There's no stitches. We remove the lid speculum. We place a shield over the eye that's clear. The patient's seeing immediately. They go to recovery, have something to eat and drink, and then are brought home.
And, it seemed like it was maybe 15 minutes. I don't know, it wasn't very long. Your recovery time is pretty rapid with it, and my wife drove me home and everything was fine.
And then after the cataract surgery, it's a instantaneous, dramatic improvement in their vision where all of a sudden colors are more vibrant.
I could see so much better. I mean, the colors were magnificent, and that's what I really, really noticed there.
I had my surgery at 12 o'clock on a Monday, and Tuesday morning when I came in for my follow-up, it was about 8 o'clock. I could see 20/15 out of my left eye the next morning. It was amazing.
And I would say it takes about 3 to 4 weeks to reach stability.
People were amazed that I don't wear glasses any longer. I wore glasses for a long time. I've told everybody that I thought this was probably the primo place to go to.
Dr. Pepose and the Pepose Vision Institute do a really nice job. They're very customer-oriented. They're very focused on making sure they do the right thing for the patient.
I felt like they had a genuine interest in improving my health, and I felt really, really comfortable here.
I would highly recommend Pepose, Dr. Pepose and the Pepose Vision Institute. I think the whole staff, it was a very good experience for me.
The ability to give back that gift of sight is remarkable.